All right, it's Friday Eve, Thursday in Arizona. Everybody's waiting for this day because they're waiting for the governor's update coming at 3 o'clock this afternoon. So in about 90 minutes, we'll be breaking so that we can catch up with what Governor Doug Ducey has to say. We'll have that right here on Facebook Live. We'll also have it on ABC 15 on air and online. So all the streaming devices, you can find it everywhere today because all eyes are on Governor Ducey as we wait for the very latest on education and any further changes our state is taking, any changes they're making through this pandemic. Of course, we're here to walk you through the numbers as we always do each afternoon. I'm Katie Rammel. Alongside me here, our data guru, Garrett Archer. We see so many of you saying hello to us. Thanks for joining us on here. We'll get to your questions. If there's some specific number you're looking for, let us help you find the data. We can do that. Just post the question and we'll get right to it. But we'll start, as we always do, on the summary page from the Arizona Department of Health. And Garrett, as we mentioned this, we should also say that we have just passed a large marker across the U.S., 4 million cases within the U.S. itself. So although we spend most of our time right here talking about the Arizona numbers, we want to mark that passing as well for the United States. Garrett, how did things look today? Another day of a little bit of underreporting in some of these numbers.
Yes. Well, today we did pass a milestone, 3,000 deaths. Oh, we now have over 3,000 confirmed deaths from COVID-19 here. We do have, as you can see, the number of new cases reported today, 2335. That is off of a PCR reported of only 8732. So what that means, and that's sort of the concern we have today, is that PCR, that diagnostic test number, is only is under 10,000. So we're sort of in this issue right now where we're seeing a lower number of tests with little to no explanation as to why we're having lower number of test processing. We know yesterday we had 61,000 tests by Quest Labs that were pending, and yet we have no indication that this backlog, we have nothing from them, nothing telling us if this backlog is going to be processed. So we have so far processed only about 40,000 tests about 36,000 tests this week, and that's that the week prior we had processed about 90,000 tests. So as you can see, we are much lower in the number of tests that we are reporting right now. So this is a concern. It does give us, it might give us sort of a false hope, if you will, because we're seeing lesser number of cases off of lower tests. The percent positive is sort of about where we should expect it right now. It is always going to be a little higher with these lower test numbers because when Quest Labs does not report a lot of tests, what happens is the tests that come from hospitals and come from other labs that don't report negatives to the Department of Health, it tends to push the numbers up. So again, we have a higher than normal percent positive, but again, we just have to sort of wait it out a little bit more and see when we can get through this backlog, and then sort of rely more on the percent positive of what's actually going on with the epi curve, the date of actual occurrence, rather than these reported percent positives, because we're just seeing inflated numbers that probably aren't correct.
Yeah, so that's what I want to explain to folks on here. Some numbers aren't as stable, can't necessarily be trusted because of this change. The other numbers, however, regarding hospitalizations, regarding deaths, those don't change. This is specifically the results in the case count that would be affected there, and thus some percentages as well. So we'll be sure to let you know throughout this session here as we're talking which numbers might be affected by that and which numbers are stable outside of that. As far as what in the world is going on with Sonora Quest, we don't know necessarily. Let us tell you the things we do know. They're installing a new system that will help them process some of these tests and get results out faster. Maybe that could be part of it, but they haven't let anybody know what's going on here. So we're left to wonder, did they know they were going to have this slowing of tests? Are they choosing to slow them down for a minute to get this new system installed so then they get going faster? We just don't know at this point. So we're waiting for the numbers. We're pressing Sonora Quest for more answers here. And in the meantime, we're hoping that it just doesn't change anything about the tests themselves, that they're being stored properly as well. So we're really pushing for answers from Sonora Quest. As soon as we get them, we'll pass them on to all of you. Garrett, I don't know if there's anything you want to add on that front.
Yeah, as you said, one of the big concerns, and the Department of Health's former director did bring this up, is that there can be sample degradation with these positive tests, or excuse me, these tests that are put in a lab. They need to be chilled at, I think it was -80 Celsius or some ridiculous number, to make sure that there's no sample degradation. So if that's not occurring, we're also would be seeing some false negatives in these samples. On top of that, of course, you have to say that these people who are supposed to be quarantining for 14 days, if they don't get their test results back for 14 days, then either one of two things have already happened. They have to re-quarantine, or their symptoms, the likelihood is that their symptoms have already passed for most Arizonans. Obviously there's going to be some others that are not like that, but they're also those who are exhibiting symptoms and are going into the hospital. They're on a second priority track. There is a track of people that are getting the test processed quicker. And we also are hearing that ASU is processing tests much quicker too. So if you're exhibiting symptoms or you want to get a quicker test, it seems that ASU was the route to go at this point.
Yeah. They're doing the saliva tests. And in fact, some of our coworkers have told us that if they've had to go get tested, they're getting their results back very quick over there, and that the lines weren't long, that it was, for them, a really good experience. So if there's anybody looking for that, that would probably be a great place to go. Let us know in the comments also if you're still waiting on test results, how long you've been waiting. We're just hearing so much of that. Mary Kay's writing, I have a friend whose 85-year-old mom skipped her test in Marana, AZ, and got a positive result in the mail. How or who would they contact in the press? You said they were looking for first person examples. Okay, so these stories have been going around the internet for days and weeks now, really. We're seeing the same thing that's said in California. We're seeing the same thing that's said in Florida. Yesterday, ABC15.com, on our Facebook page, we posted a story about this in Florida that we did at our sister station. Literally every story that we've checked out of this has not panned out to be anything. People are saying that they've left the line because the line was too long. They hadn't even checked in yet. Everything that we've checked out is not the case. So if you're in Florida, the governor of Florida has said he'd like to hear from you if this happened to you, so that they can look into it. Same thing. I have traced down so many different people who said that this happened to a friend or their mom or whoever. We have found 0 instances of this happening anywhere. It doesn't mean that it couldn't happen, but what this sounds like so far is just a vast internet rumor. So if this has happened to you, you can email us at share@abc15.com. I'll give that address one more time, share@abc15.com. It's got to be the first person. It can't be this happened to your friend. It's got to be somebody who can tell us that this happened to them and explain it, so that we can go investigate for you. But otherwise, at this point, same thing in LA. A friend who works out there asked for people to contact her. They just have found no cases of it. So at this point, it seems to be a very vast and vastly shared internet rumor. Again, doesn't mean it couldn't be true, but we have found no cases of that across the U.S. so far. So let us know if that specifically happened to you, not a friend, but to you. And we'll look into it for you. All right, Garrett, some of the other numbers that we were getting in, we talked about the county, and obviously counties have a different population size. So it's only worth noting, but remembering that population size varies. Counties aren't set by population. We are about the 4th most populous county. We talked about the possibility of us moving from number 3 in COVID cases up to number 2, surpassing Cook County, and that did indeed happen this morning. Right. So although our numbers are trending down, we're still rising as it relates to other counties out there. And Garrett, you said this is like the 3rd day of downward trending cases that we're seeing, or where are we in that?
Yes. So the Ducey's press conference is going to have a lot about education, and I know some of the education groups, as well as the former director of health, as we referred to him, have said we need to follow some sort of gating criteria. And one of the gating criteria they talked about was a 7-day moving average of cases going down for at least 14 days. So I ran those numbers today, and as of right now, we're at about a 3-day decrease. So we're 3 days into 14 days of decreasing case counts. Now we have been farther. We were about 5 or 6, 7 days last week, but we're at 3 right now. That could keep going. We just don't know yet. So when they start processing this backlog, if the percent positive is still low, then our case counts will still continue to decrease. So.
All right, well, we'll keep tracking that as well. One of the other things that we're asked about so much, and we'll get to the questions in just a second, our long-term care facilities have been such a concern. Early on, we weren't like locking them down so tight, and there were high death numbers within that, and we have to protect our most vulnerable population. And it seems, at least in Arizona, that those numbers are changing. We had a high percentage of people that we lost who were living in those types of settings, but that percentage has actually gone down a bit now.
Yes, so the place for us to go to look for these percentages is Maricopa County's Department of Health. They have a dashboard, a COVID dashboard that gives a bunch of demographic information about the pandemic within the county. If you go to deaths here, you can see the curve and how it looks. This dark blue are the long-term care facility deaths, and the lightish gray are the just deaths in the community. And as you can see early on, their long-term care facility deaths were making up the majority of the deaths. Somewhere, I think when we calculated it at its height, it was about 70% of deaths. So ever since about the end of May, as you can see, as deaths have increased, the deaths in long-term care facilities has not increased, and it's been stable. In fact, has gone down. And now we are at 39% of deaths in Maricopa County have come from long-term care facility. And that number has been dropping dramatically. As I say, daily it's dropping. So it was 40% yesterday, 41% the day before. I know 1 point doesn't sound a lot, but when you're talking about these kind of numbers, 1 point is actually a pretty large drop. So just if this keeps going down, it's just going to be interesting to watch what happens. But it just seems to indicate that it will continue to go down.
Yeah. Sure. Let's see. Since you're on the Maricopa County page, can we look into some of the age breakdowns and some of the other demographics that Maricopa County gives a few more specifics that we can dive into and kind of get a really good idea of how things look? And you're on the risk factors page there.
Yes, so on the risk factors page, they do have a little bit more of a breakdown than the AZDHS gives. So you can see. And again, we'll have to pretend that there's this line right here between 65 years and chronic medical condition. You can see that all COVID cases, more than half of the COVID cases come from the 20 to 44-year-old range. Hospitalized, the majority of them come from 65 plus, and then ICU 54, and then 75% of the deaths have come from 65 plus. Now, this chronic medical condition, that is agnostic to the age group. So what this is saying is that despite the age group, ethnicity, anything else, 9% of the COVID cases are chronic medical condition, but they do make up more than half the deaths. And highest risk is defined as people are, as you can see up here, 65 plus or who have a chronic medical condition. And as you can see, 16% of cases, yet they make up well over 85% of deaths are coming from that particular category.
Garrett, what other pages do you visit often on this Maricopa County or Maricopa.gov site?
I do I don't visit this often. This is more of a once a week thing, but always pay attention to sort of the per capita numbers for the race and ethnicity. As you can see, American Indian, Native Americans have been hit the hardest as far as the percent of their own population. All of these numbers, this one although does not have, oh, here's ethnicity, sorry. I knew that was different here. So, and you can see Hispanics have been hit much higher as well than those who are not Hispanic or Latino. So I do check this every once in a while. Other than that, the care facilities themselves, they have their case numbers and hospitalization and death numbers here. This is a rundown for anyone who's interested in what's going on in Maricopa County. If you go to overall cases, this is the one I spend the most time with every single day, because I have to get these numbers. So, but you can see what they look like from the day before and then how they've changed. That's that plus right there. And then this age group, this is where you can get this particular hospitalizations, everything across each age group rather than as far as, the pie chart, if you will. Now you're getting it against its own, the age group itself.
Yesterday, we had a question that came a bit after we had kind of shut things down, and I want to get to it because you're on that page right there. Someone was asking about the number of deaths for young people in our community because of COVID-19. And we see on their site, they break it down from a baby to age 19. So what number? I believe we were at 9?
In total, we're at 11 for that entire for AZDHS. That is 0 to 20. That's adding one more year to that, but it is 11 for the entire state, and then it's 5 for Maricopa County at 0 to 19.
Yeah, so this is the place where you can look for it. I'm sorry we didn't get to that question yesterday. Obviously, there's so many comments and questions coming up. It's hard to get to everybody, but I thought it was worth noting there. Just a few seconds ago, Kristen was asking about these numbers from Maricopa County and if we're getting them from the CDC or from the White House. Kristen, I want to let you know we're getting these straight from Maricopa County themselves. So although there has been much conversation and concern about where this data goes, whether it goes to the CDC or to the website, it's or rather to the White House, we're getting it right from Maricopa County and right from Arizona. So we don't have to worry about where those numbers go separately. So.
Yeah, I mean, really, realistically, the HHS numbers, when people talk about the HHS, they're missing sort of the point of what the HHS is doing. You know, they are aggregating numbers for the entire country. So they're not looking, they're taking in data sets from 50 different jurisdictions and then probably 52 or so, and then aggregating it into a specific nationwide sort of data set. But as far as our numbers themselves and every other state, everyone has their own reporting mechanisms that are not manipulated or touched by any sort of federal system. They don't touch that. It goes county health departments, hospital systems, to the Department of Health, and then up to the CDC for further aggregation. So I've seen this a lot, but it's really sort of a misunderstanding of how sort of the chain of custody works with this documentation. It just doesn't simply work like that. There's not enough people who work for the HHS, CDC, or anyone like that to stand over the shoulders of epidemiologists all across the country and say, hey, you need to change that number, or we need to look at what this number is. That simply is not going to work like that. These numbers are these numbers because they're coming in from county health departments and from the hospital systems.
Right. Paula asked just a few minutes ago, AZ was ranked the worst in the world. She was asking something about that. Do we have any place that she would be able to see sort of where Arizona ranks? I know there's so many different websites that have kind of split it out per capita or just to kind of see how things are changing here. We were one of the fastest growing. It's kind of interesting to see when you look at maps across the nation, Garrett, too, because you know, some of the highlighted maps that show growth week to week have us not highlighted right now because this past month was so rough for us, and now we're slowly starting to get at least a bit of a handle on it, that we're seeing a bit of a dip, so we're not highlighted in all of the maps. But there's Paula's comment. How long have they been saying Arizona was the worst in the world? So let's see. This is through U.S., right, Garrett?
Yeah. I'm having. It's going to take me a while to find something that aggregates that usually in almost all these data sets, the states and territories are separated out themselves, and then the U.S. is placed against the world map. So right. I have to find something that actually puts Arizona against the world. Other than that, you just have to look at the normalized by population. So you look at the right here. This is our top. 528.2 was our top, and then you can go up here to the world normalized by population, and you can see right now at max. I can't see that. Hold on, let's see if I can go to the max here. The y-axis needs to go to all data. And you can see that it appears that the highest rate belonged to Chile on day 99 at 530.9. That was a long time ago. And that almost looks like there's a data issue there. So what I would say to that is that if you try to break those down by rate of population, hard to do when you're talking about nations that have tens of millions of people. But there's pandemics that are different everywhere. But yeah, it does appear that at one point, we did have a very bad pandemic as far as the impact on the local population compared to other countries.
Yeah, and you could see on that map that you showed us before, that was just the states. Oh, there it is. Where Arizona was at the top. Can you scroll over? Is that by date there on the bottom? We can get that exact metric. So what date is that?
Yeah, so this is
16 days ago.
16 days ago is when we hit the peak. And you can see that just after that, so that was 16 days ago, and then just in the last week or so, 6 days ago, Florida sort of took our place at the peak of the cases. So now, of course, just to be fair, we're looking at cases here, but let's look at the deaths average too. And you can see that we are right now, as far as the states, we have the highest death average per capita right now. But as you can see, just looking at this stuff, if you go to the y-axis and you go to all data, you can see that there were much higher per capita death numbers early on. But right now, just as far as what we have, we are at the height right now.
All right, that helps. And someone was just asking if that graph can be found somewhere else. Michael would like to see this graph bigger. Is there a website where he can find that?
This is 91-dvoc.com/pages/COVID-visualizations. So this is a professor who put these graphs together, and they can all be animated, they can be saved, they can be exported. There's a bunch of ways you can play with this data, and as you can see, there's a way to look at the x-axes. You can change the highlight so that you're looking at a different state. These are very, very robust graphs that can make you can make a lot of adjustments to them.
Well, DVOC, for those of you, that's obviously COVID spelled backwards. So you don't even have to jot it down. You'll be able to remember that. But that is the site that helps. Let's see. Okay, Cecilia's asking, so we've had 1,000 deaths in 14 days. On Twitter today, I know, Garrett, you, and we talked about this last night in our newscast, where we hit some of these markers for dates, because we passed 3,000, unfortunately, 3,000 deaths today. And although we talk about numbers on here, we always want to pause to remember that these are real people. These are friends and family and brothers and sisters and cousins and people you do business with and people you love, and that every death, there is a family member behind it or a friend, and we want to pause to just make that very, very clear as we move on through this. But the markers are worth noting because of how quickly they were changing. So where did we hit 1,000? Where did we hit 2,000? And then today is the date we're passing 3,000.
So yes, today we hit 3,000. We hit 2,000 or crossed 2,000 on July 9th. We then crossed 1,000 on June 10th. So it took us 14. So that's basically what is considered exponential growth. It took us a month to get from 1,000 to 2,000, then 14 days to get from 2,000 to 3,000. And then 500 deaths, just to go back a little farther, came another, again, exponentially, it came on May 8th, so it was a month prior, and then as soon as you get a little later, like 250 was on April 24th. So that's sort of the numbers as far as how we went. It was that 500 to 1,000, 2,000 to 3,000 that has been exponential so far. Now the sort of, I don't want to say good news, but sort of the way to look at this is that cases lag deaths, and June was a terrible month for our case numbers. They were rising at incredible rates. So as we get through, we're now at July 23rd, we are almost past that 27-day lag. So if the numbers continue as they are, then we should stop seeing an exponential growth in deaths sooner than later. And the models do play this out. They're all thinking we're still on the lower end of the slope. We should not continue to grow. Of course, the number itself is going to grow, but it shouldn't be growing at the same rate that it did and is doing now, because of the fact that we're coming to the close of that 27-day lag.
Right. Rate versus actual number, two very different things. Rita's asking, the deaths reported are some that were months ago. So we can show Rita the chart of how we're taking those exact dates and plugging them in so that you can see. And Garrett will show you his graph. The lighter blue are the dates that are just being plugged into the chart. And then it'll give us a better curve as well to kind of show us how things look.
Yes, I'm sharing a screen. I'm just going to zoom up here, and I'm going to show you what those deaths do look like. Rita is correct. Reported deaths do come, and they are assigned the date of occurrence. Even though they're reported that one day, they are assigned a date of occurrence. So as you can see right here on this chart, blue is added today, and dark blue is the sort of the number that was there previously. So most of the deaths are added prior to this this stop of the rolling, or excuse me, after this 14-day average. So in the last 10 days, that's where most of the deaths are put. And then, but you can see there are deaths that are put in here and added from, it looks like this one as far back as middle of June, and some of these spatterings. Now, what this is people need to understand what this is verification by the epidemiologists over at the AZDHS. They are taking, this is very meticulous data for them. You know, these are not just, as we say, as you say, these aren't just statistics, numbers for everybody. They want to make sure they get this right too. So when they get these reports, they check them. If something looks wrong, they take it out, they back check it, they check it again. Because in the world of an epidemiologist, although for our world, it's we want the data today, we want the data today. For their world, it's we want the data in 3 months to be as perfect as it's supposed to be. So they're going to spend a lot of time making sure that this data is correct. And it might be frustrating for us to say, whoa, it changed. Why did it change? Or why was this added? And 9 times out of 10, there's a perfectly reasonable explanation as to why it was added from, to 2 months ago or whatever.
Why that adjustment made in there. Nicole writes that the lag in all this, in this reporting is confusing. And we would agree, Nicole, it can be confusing. That's why we always want to jump on here and help folks better understand it from the research that we've done and the time that we've spent on it. Nicole, you call it confusing. That's very polite, because what we would call it is really frustrating some days. I know for Garrett, who's putting all these charts together, it can be frustrating, to use the best word I can here.
So I'm dynamically calculating the lag now. So you can check to see every day it recalculates what the lag is. And it's based off of how many of these light blue, essentially, if these light blue markers are large enough to be over, I think I put it at, if it's more than, if the date changes by more than 5% or more than -2 or 3%, then it's considered an unstable day. So that's when basically it's like, okay, I need 3 unstable days, and that's where it's going to be a lag, because that's where tests are being put in. Cases are being put in with unstable days. So right now, we're still seeing tests being input, cases being input 15 days from today, prior to today. So that's essentially what your lag is 15 days. And you can see that in this chart too. This chart is basically case changes by week. And you can see the week of July 5th, 986 cases were added for that weekend. We should be seeing more of the tests being added here and here, not there. So this is where you're seeing this lag. And we're seeing it visually with this data, because this should be sort of flipped. This should be down around here, and these two should be up. But right now we're seeing just cases being added because of this lag.
And Garrett, the normal, if you will, lag would be like 7 days, although we're seeing 15.
Yeah, 7 days will always be a lag. So when anyone says, oh, it lags for 7 days, that is, we have to give them time to input the data properly. So there's always going to be a 7-day lag no matter what.
Right.
But it should be 7 to maybe 10 days. And right now we're at the 15-day mark, which is, really concerning.
Yeah, Marianne was just writing that the funeral homes in Arizona are just swamped right now, and Marianne, we can say that they have. There's Marianne Rodriguez writes, funeral homes are swamped as well as cemeteries. This is insane. All of these deaths. So what we can say, Marianne, is that because these funeral homes are so swamped, the county has actually brought in more coolers for the bodies. We've shown you some of the pictures as those coolers arrive out there. It's something that they haven't had to request in 10 years. So it just shows what kind of circumstance that we're in right now. But I believe 14 coolers in total, Garrett, came into Maricopa County to be able to release these places.
I do have a picture. I'm just trying to pull it up right now. So just give me 1 second.
Yeah, we know that we're seeing the busy funeral homes. We're seeing our healthcare workers taxed to the limit. I mean, so many of our essential workers as well. So we want to recognize all of those people. And I mean, this is taking an emotional toll as well as physical for so many. And it's okay, Garrett, if you can't get to that picture.
Oh, I found it. It's right here. This is this picture was taken this morning, I believe it was.
Yeah.
So 14, I think it is. This is how many that they have right now.
Yeah, and this is right outside the medical examiner's office, so that's where they're bringing all the coolers in for the medical examiner's office, rather. Adam writes, "We just need to open the state up." Adam, our state, for those of you who are not in Arizona, our state is open at this point. The only thing that's closed are the bars, let's see, what else am I missing? The clubs, the nightclubs, the workout facilities, and movie theaters. Yeah. I always forget the movie theaters because a lot of them hadn't even opened up just yet. So for the most part, Arizona is open. It's just those select places at this point. And that is set to expire on July 27th. So more than likely, we'll hear something from the governor at 3 o'clock on that, whether he's going to extend that executive order beyond Monday, or if he will continue with that, or if he will have some metric by which each particular gym has to be judged, and then they can say that they are indeed safe to reopen, as well as the movie theaters and the pools, the what do you call them, with water slides, water parks. That's
water parks.
Well. All right. I want to get to some of the other questions. Yeah, we're expecting something on schools. I'm seeing a lot of people comment on that. Here's the thing. On abc15.com, there's an interactive map, and you can jump on that site and click on your particular school district, a neighboring school district, and see what their current plans or proposed plans are. Daniel Lerner, our reporter, has it all split into sections as well. You know, the start date for many schools at home. Most of us are ready to teach our kids at home starting a week from Monday. It's the in-person dates that have been changing so much around the valley. Some places have moved it back past October because we do have fall break, what's called fall break here in Arizona. Some places have moved it back to Labor Day. Some have left it with the aspirational date of August 17th. So let's see. What are some of the other things that you've noted? Also, I should note, we're expecting Kathy Hoffman, the state superintendent, to be there at the news conference at 3 o'clock with Governor Ducey. We understand that there's going to be a lot more guidance, a lot more clarity coming to our school districts, and that she has been in an ongoing conversation with the governor about this, and they're going to be able to lay out the next steps. And I know that's what everybody's waiting for. So let's see. Someone's writing, "I'm so sick of the plateau. When are we going to see cases go down?" We're sick of it too, but we're just happy to be at least in a plateau, because we were climbing in those numbers for so long. Jim writes, "Thank you both again for your efforts." Jim, thanks for joining us on here and taking time with us.
And to be clear, there has been, even with the plateau, you know, the biggest concern, of course, is the test backlog. But we have seen a lower percent positive, not just on the daily reports, but also on the AZDHS's testing, the percent positive. I'll go to that really quick. I was about to go over hospitalizations, but we'll go over that quick. And you can see that right here. This is the PCR, the diagnostic test by week. I'm going to darken my screen so it's a little easier to see. And so what you can see is that it's, say, start of May, sort of when we began this ramp up, we were at 12%. Then we were at 14%. And then we're here in the middle of June, 18%, 20%. We hit a high of 21%. And then after that, in July, we went down to 19% with almost a very similar, almost equal number of tests. Right now, we're at 15%. Now we're dealing with a backlog right now, which is a problem. 15% is still a very good number right here with the number of tests that we have. That's not enough tests for that to be valid, so we're not going to look at that 14% quite yet. We need more tests to fill in for there. But we are also seeing a higher prevalence of antibody tests too. You can see week by week, you know, we started out here, 3.4% of antibodies were coming back positive. Then we're at 7. Now we're at 12.4 for last week. So you're seeing sort of, you are seeing sort of good news on the testing front where we can, where we do have good news to share. So.
Any rights are trying to help us. Yes, we are. We don't want to make decisions for your life. You know your life best. You know your healthcare situation. We just want to show you each day. This is why we've been on here pretty much this whole summer now, to try to walk you through the numbers and help you really understand where you can find these numbers. You could develop a metric for yourself that you feel, this is when I feel it'll be safe to send my kids back to school. This is when I feel safe going back to the gym. Whatever that is for you in your life, we're just helping you understand some of the graphs in the website so that you're able to find where this information is so that you can best make those decisions for your family. Katie writes, hi there, can you please share that website again for school information? Thank you for your help. Katie, you're welcome. Let's see, the website is abc15.com/schools, and then it's got an interactive map. You hover over your district and it's going to give all the latest information on that. Another good person to follow is Danielle Lerner, our education reporter here at ABC 15. Man, she has just been all over this, getting the very latest details on what the plans look like for school districts all across the state. So those two places are the best places to go. You'll be able to find out the latest information. And then, of course, watch the governor's news conference in about 45 minutes, because all of that could change if he pushes back the date. And really what's being talked about downtown a lot is that date being pushed back after Labor Day. So we'll see if that's the case for everybody. Of course, everybody will be waiting for that news. We were hoping for it last week and we just didn't get any information on it. He said, wait one more week. So we are. What other info and numbers did you take particular notice in today? You know, Garrett, we're always asked about active numbers, and you kind of have to estimate what that would look like. I mean, you're kind of trying to put some figures together to kind of see what that would look like. What sort of range do you think we have for active cases right now in the state of Arizona?
So based off sort of the the case sort of age that we've sort of experienced, cases that are over 14 days old in the state, and this doesn't matter. This is backlog agnostic. This is just when the date of occurrence of positive collection was. So cases that are over 14 days, it's about 120,000 of the cases are over 14 days, and then about 76,000 are over 28 days. So our active cases is going to be sort of something in that range, then subtracted. It seems that we probably have about 90,000 active cases right now.
And that's the best number we'll have at this point,
yeah.
and a rough estimation.
Yes, it's a guess, of course, but it's the best we can come up with.
Yeah. Some people were interested in being part of us getting closer to a vaccine. And there are some places you can go to sign up to be a part of the research that's happening right here in Arizona. There are two sites that we just talked about this week that I want to mention. One is HRIAZ.com. That's Hope Research Institute. AZ.com, and they've got a section there for Arizona. They're doing some of this cutting edge testing right here in Arizona, and also cctresearch.com. So that's the other site, cctresearch.com. If you're interested in helping to let people know a little bit more about what's going on with this, that is the place to sign up. I just saw a comment. David Kerr writes, Moderna vaccine starts 7/27, one site in Tucson, 2 in Phoenix. That's it. I believe the Moderna one is the first one I gave, which is the HRIAZ, and CCT hasn't specifically said which ones they're using, although you could probably connect the dots on what that is, but I'll leave that for them to officially say when they're ready. But those two start up their research very quickly. Yeah, as David mentioned, 7/27. So if you're able, those are the ways that you can help. Let's see, any other numbers that you were tracking? I saw somebody ask a minute ago about RT Live, or R Not Live, which is RT.live. Because the governor always highlights it in his news conference, we'll more than likely see him talk about it at 3 o'clock. The past few days, it's been upper 90s.
Yeah, it's not moving that much right now. It's at 0.98 right now. It was at 0.97 yesterday. It's at 0.98. It could likely go back down to 0.97 tomorrow. It's sort of stayed in that range right now.
Yeah, and it probably won't change that much if we're not processing a lot of tests.
Correct.
Because it's dependent on those. So worth checking, and Mark's putting up the website right there. Yep, Mark, that is the exact site to go check that out. Created by the guys from Instagram, so it's pretty easy to read. Look at that picture. It's pretty easy to read on there, and it's got some other numbers that show you what other states look like. So we know so many of you are watching from other states. We always talk about Arizona numbers, but I've heard from people all across the U.S. who have joined us in the afternoons and then taken this information and used it in their own research within their own state, and they're able to kind of understand what things look like in their area as well. So thank you to all of you who are joining us from other places on here. All right, we're about getting close to wrapping things up. So if you have any other questions really quick to send out to us, we can quickly get to some of those answers. Garrett?
I do want to go over hospitalizations.
Yeah. Oh yeah, we haven't even done that yet today. Our afternoon has flown by.
I know. So far, again, we're in a good place, much better place than we have been with hospitalizations. So this is on, again, everything's from the AZDHS website. These numbers are directly reported from the hospital systems to the AZDHS. There is no inputting data from the AZDHS or any other entity. And you can see here, ICU numbers, 87% right now. That's down from a high of, I believe, 91 or 92%. Emergency room visits, always a little noisier, but still lower this week than it was last week. And these are total. This has nothing to do with COVID-19. This is just total bed usage. And then the inpatient general acute care beds down to 85%. And you can see this has sort of been hovering between 85% and 85% for most of the month here. So let's go. We're going to go look at COVID-19 specific metrics. These are the hospitals have flagged these particular patients or these beds as COVID-19 beds. And as you can see, inpatient, the largest number, but as we hit a high on July 13th of those of 3457 or 517, it appears, and then or 3517, my apologies, and then we've gone down to 2966 since then. So a nice nice downward trend on inpatient COVID-19. We've seen a slight increase, but really a leveling off of the ventilator uses. ICU beds lags the inpatient beds a little bit, but also another decrease. Discharge, we had a higher discharge number today. Emergency rooms still going down for the most part, which is a good news again, because that's probably the best leading indicator. And intubations themselves going down to one of the lower levels since it looks like right here, since June. So all in all, a lot of these are great numbers for us as far as hospital resources and allocation. It doesn't, at least, and this is statewide numbers, this doesn't mean that there's particular hospitals that aren't being stressed. There's absolutely going to be hospitals that are dealing with specific pandemics that are stressed, but our statewide system looks like it can now handle, at least if things start to increase, there's a little bit more room now for them to handle things without having to go into crisis care.
Yeah, I'm so glad that last part, because we often hear from people on here who say, wait, the place I'm working is slammed. This is not necessarily reflective of specific hospitals. This is overall, in general, how our state is looking. Crystal's asking, repeat cases. So Crystal, in Arizona, they are deduplicated. So they have worked to make sure you could go get tested 100 times. You're only counted once if you're a positive case. So positive cases are deduplicated. Janet's asking, what's a good PCR percentage? Okay. I'm good. Zero would be good at this point. So I'm assuming she's asking for the positive percent of PCR tests. So on this chart, Janice, we always find this on the Arizona Department of Health site. There's a percentage that's up at the top. That is the percentage from the whole pandemic. So it's technically, it is accurate, but it's not as fair to look at because it doesn't give a current snapshot of where we are. What Garrett has scrolled down to at the bottom of the page, it's broken out by those positive PCR tests week to week. So that's going to give us a better idea of where we are. We'll just show you where this is because we really talked about this a little bit earlier. And so we won't get too thick into the weeds, but let's look, Garrett, what was the percentage maybe at the end of May? It was down almost as low as.
So it appears 5%, it looks like to be the lowest we've had. And 5% is sort of the threshold of where you want to be. That's sort of, if you look at the gating criteria that are set up by a lot of these organizations, they're saying, we want our PCR positives week by week, day by day to be under 5%. So, yeah. And we were hitting that. When we opened up the state, we were hitting those 5% targets. Granted, the testing was only 35,000 at the time, but we were hitting those targets. And now, as you can see, we were not close to hitting those targets at 21%, and we've gone down to 15%. So we have some work to do to get to that 5% number, but we're on the road to it.
And that's what I've heard a lot of the sports teams were saying as well. That's 5% is kind of going to be their threshold for a lot of things. Another viewer on here is asking, Katie, contact tracing, why is it less than 5%? The short answer on contact tracing is if we don't have test results in, contact tracing is kind of pointless, because if we're taking 14 days to get the test result back, well, who have you been around in the past 14 days? So we got to get these test results coming in faster, and then we can move on and focus on getting the contact tracing to happen. Because if we don't have an answer whether you're positive, we could be tracking down people and you end up being negative. So results have to come first. Contact tracing would then follow. Let's see. So many questions coming in. Let's see. They're going by so fast. Oh, Kristen's asking, is anyone reporting on our reinfection rate? I've had it, and I'm afraid I'll get it again. First of all, Kristen, glad you're over the first round of it. Hopefully you will not get it again. I don't know that we have any data, because this is such a new experience that's happening to people. Garrett, have you seen any information on it? I have not yet.
No, there's white papers circling around through like journals like the Lancet and other places that are trying to figure out what the reinfection rate is. But as you said, I mean, this is a race against time, similar to the vaccine. Without time, we just don't know what that is.
Yeah. So Kristen, glad you're doing better. Stay safe out there. And as soon as we hear something on that, we'll of course, let everybody know on here as well. Oh my gosh, the time. We are almost out of time. I didn't even realize we've just been chatting away here. Let's give folks ways to contact us. So, I'm sorry, we just cannot answer every single question here. Let's see. There we go. Sorry. Having to update the comments on there. They're just going so fast. So, okay. Contact us if you need. abc15.com/coronavirus is the best place to find all the very latest information. The reporting that we've been doing on this, everything Arizona is right there on that site. Garrett, a lot of people are following you now over on Twitter. That's the best place to find him. His charts come out every single morning, and then he's updating all day. Garrett lives and breathes these charts and this data and helps us understand it. He is our data guru here at ABC15, and we're so lucky to have him. There's his Twitter address, at Garrett_Archer. You can find me on Twitter as well, at Katie Rammel. And then also over on Facebook, I know so many of these names that I'm seeing come up in the comments have joined our conversation over there as well. My Facebook page is facebook.com/news from Katie. And now, the governor is set to speak in about 30 minutes. We'll have that right here on Facebook Live. We'll also be carrying that on on ABC15. We'll post it up on our YouTube channel later. It'll be on all of our ABC15 branded places that you're used to finding them. And then if you can't make the news conference or you can't get updated on that, we have a breakdown of everything for you coming up on ABC15 News at 4, which will likely be a bit delayed because these have been going more than an hour, on ABC15 News at 5, 6, and at 10 p.m. And as always, if you've got a question for us, join us weekday afternoons right here at 1:30-ish as we try to get those questions answered for you. All right, I think that does it for us, Garrett, unless there were any final thoughts. We'll try to sail over SnorQuest and get everybody some answers.
We're crossing our fingers that we start getting tests tomorrow.
Yep, we'll try to get you some answers as soon as we can. Otherwise, we'll see you back here tomorrow, everybody. Thanks for making time for us today.